Hi, I'm Dr. Adil Hassan. I'm a consultant in Medical Oncology. I'm working in Apollo Excelcare Hospitals in Guwahati. Today, I'll be talking about an important topic, that is the newer modalities of treatment that we're using in cancer nowadays, or the recent advances in cancer treatment. So as we know, cancer therapy can be divided into three major parts. One is the surgical type of cancer therapy, one is a medical type of cancer therapy, and one is a radiation type of cancer therapy. Now, which patient exactly needs what type of therapy depends on one, what is the type of cancer, what is the patient characteristics, and what is the stage of cancer. If I give you a simple example regarding breast cancer can be divided into stage 1, 2, 3, and 4. Stage 1 means a lump which is there in the breast, which is very small in size, that we can say it is stage 1 in a layman's term. Stage 2 is a lump which is there in the breast, which is a little bit bigger in size. If it has gone to the surrounding areas, that is the armpit, we call it stage 3. And if it is going to maybe the liver, the bone, the brain, or different other parts of the body, it is called stage 4. So the reason why I told you about the different stages over here is, for example, stage 1, stage 2, stage 3, we can try for complete cure of the cancer. Maybe in stage 1, the surgeon is the mainstay or the main person for your treatment. That is, if the tumor can be completely removed from the body in one shot, maybe that way can cure the patient. So in that particular situation, the surgeon is the main person for you. Suppose it is stage 2 or stage 3, a person like a multidisciplinary team, what we say, that is comprising of the radiation oncologist and medical oncologist, we come into the picture. We try to give some injections or chemotherapy or targeted therapy or hormone therapy, and we try to bring down the tumor size such that it is more easy for the surgeon to operate and to make sure that the tumor doesn't come back again. So, but now if it comes to the stage 4, that is, if it is spread to other parts of the body as well, it is not a death sentence. That is very important for us to know. Some people used to think maybe 10 years or 20 years back, if you have stage 4 cancer, if it is spread to different parts of the body, it is the end. It is definitely not the case. Fortunately for us, myself being a medical oncologist especially, I am a specialist in giving forms of therapy which not only attack the cancer cells in that particular area, but it is going across all over the body and trying to attack the cells. So this pen can be given in two forms. One is an oral form of therapy, or one is an IV form of therapy. Generally for stage 4, we don't do a surgery and we don't remove that particular part, because the disease is already spread to other parts of the body as well. So in this type of treatment, maybe chemotherapy, targeted therapy, hormone therapy, or immunotherapy, these are the 4 new modalities of treatment which have come into existence over the last 1 or 2 decades. So let us go a little bit into the details of all of this, and maybe here we can keep as breast cancer as a reference, because that is definitely one of the most common types of cancer that we see across the country, and definitely that is the leading cause of mortality for cancer for women in our country. So when it comes to say the surgical advances that we see nowadays, of course we have better techniques, we have robotic surgeries, we have laparoscopic surgeries, the anesthesia techniques have become better, the antibiotics have become better, so the infection rates have come down over time. So we have seen a lot of advances when it comes to surgical techniques. That is one thing. The same thing when it comes to radiation therapy that we say, wherein we focus beams of radiation like a magnifying glass to make sure that that particular area or that particular focus of cancer which is there, that is removed from our body. There are newer techniques called IMRT, 3D CRT, okay, and there are different planning techniques that we use to make sure that the cancer is killed and the surrounding tissues are not affected. Maybe proton type of therapy which is available in our Apollo Proton Cancer Center, that is, they are one of the pioneers when it comes to proton therapy, wherein you are giving radiation and trying to minimize the side effects to the nearby organ. So like I said, when it comes to the medical part of the therapy, we do have something called chemotherapy, which we have been giving from many decades now. Of course, the chemotherapy what we give today versus the chemotherapy what was given maybe 10-20 years back, it is vastly different. One, we have more information about how these drugs act over the body thanks to a lot of studies which have been done nationally and internationally. So the newer regimens that have been made, the newer protocols have been made, are much more different when compared to the older protocols in terms of the efficacy, in terms of bringing down the side effects, in trying to make sure that the cancer completely goes out and doesn't come back inside the body. So apart from the IV cancer therapy that we give, we also have something called oral type of chemotherapy also, which is available nowadays, which we give for certain patients who cannot take IV therapy for whatsoever reasons, or something like a maintenance therapy as well. So apart from chemotherapy options, which we have been using, like I said, there is also something called targeted therapy. So what do you mean by targeted therapy when it comes to medicine terminology is, we need to understand at a genetic level, our cancer cells are different from the normal cells. That means there is some defect either inside the DNA of the cancer cell, or there is some defect in the structure of the cancer cell. So we utilize this particular concept to make sure that we give some particular injection which goes and attacks only that cancer cell and it doesn't attack the normal cell. Now, taking the example of breast cancer, one of the most important type of targeted therapy which was discovered around 20 years back was anti-HER2 therapy. So HER2 stands for human epidermal growth receptor. Now naturally, if the growth receptor is more on the cancer, that means the growth will be more faster. It can spread more rapidly. It can go to different parts of the body. So it all started when the scientists noticed that some types of cancer are growing way more faster when compared to other types of cancer. Herein they discovered a molecule on the surface of these cancers called HER2. Now this HER2 can be positive in almost 1/4 of the breast cancer patients, and we give some injections called monoclonal antibodies against this HER2. And now over a duration of almost 20 years, we have the first generation anti-HER2 therapy called trastuzumab, the second generation called pertuzumab, we have TDM1, we have TDXD1, and the lapatinib, neratinib. So there are a lot of anti-HER2 therapies also which is available, which we give for as a targeted therapy for breast cancer patients. But it is important for us to know, before you take this particular treatment, we have to ensure that that particular gene or that particular abnormality is positive inside your cancer cells or not. So next, coming to immunotherapy. This is a very interesting new type of therapy wherein you are training your own immune cells inside the body by stimulating it or by boosting it, by giving an injection inside the body. It is going to different types of parts of the body, and then it is stimulating your T cells, what we say, to go and attack the cancer cells. So this is the concept of immunotherapy. And hormone therapy. Like I said, we understand that almost more than half to 2/3 of the breast cancer patients do have something called hormone receptor positivity inside their tumor, wherein we check by immunohistochemistry. We do a special test on the tumor sample to see if at all if these particular receptors are positive or not inside the tumor. And then suppose if it is estrogen receptor positive or the progesterone receptor positive, that is, which is positive for the female hormone receptor, suppose if it is positive in this situation, we give something called anti-estrogen therapy for the patient. In this also there is a lot of advances. Earlier 30-40 years back, we just had one drug called tamoxifen. Now we have something called anastrozole, letrozole, fulvestrant, girestrant, camizestrant. So there are different types of drugs which is available for us. So this is in brief regarding the newer advances in cancer therapy. What I want to say is, there is a lot of advances that has happened both in the diagnostic and the therapeutic part. If you or your loved one is detected with a cancer or maybe stage 4 cancer, do understand that it is not a death sentence. Definitely we have newer modalities of treatment which is available in the form of surgery, in the form of systemic therapy, that is targeted therapy, hormone therapy, chemotherapy or immunotherapy, and also we have newer modalities of radiation therapy as well. So with this brief, I think I'll stop for now. Thanks a lot for your patient listening. Thanks.